Good afternoon. Welcome back after lunch, and thanks to the Royal College of Physicians for an excellent lunch. It was Jane Clare Judson who reminded me that one of the origins of today's events was actually a supper around a kitchen table in South Edinburgh some 18 months ago. We should never underestimate the value of breaking bread together and the conversations that occur in these situations. So thanks to the Royal College and indeed to Chest, Heart and Stroke Scotland and Enlighten for curating what has been a very stimulating and thought-provoking day so far. Now, my name is John Sturrock. That name may be familiar to some of you in that I was responsible for work carried out back in 2019 at the instruction of the Cabinet Secretary for Health into allegations of bullying and harassment in NHS Highland. So I have some knowledge of the health and social care sector. I've also been privileged to be part of the conversations to which you alluded earlier on, Andy, over the past 18 months or so. And I've only been reminded today, actually, about an event which I recognise I've somewhat suppressed in my life, and that was that back in 2021, I had a stroke and have experienced the care of the National Health Service in all its wonderful parts and all of its foibles as well. So it's good just to ground oneself in that real experience. However, my primary role in life professionally is as a mediator and facilitator. And in that role, I have the primary purpose of asking daft laddie questions. So more of these shortly. And my other role in mediating and facilitating is to ensure that people have the opportunity to speak. And so in this shortish session after lunch, what I hope is that particularly those of you perhaps who haven't yet spoken may take the opportunity to do so if you would like to do so. Reflecting on questions, can I ask you just to take a moment and just reflect on these 2 or 3 questions I'm going to pose. First of all, what this morning has made the biggest impact on you personally? You might even want to take that little notebook that we've been given and jot down a thought or two. What's made the biggest impact on you this morning? And moving on from that, from your perspective, what one thing needs to change? What one thing needs to change? There's a whole lot of things, but from your perspective, what one thing? And following on from that and picking up Angelina's appropriate reminder to us all that we each have responsibility, what one thing can you each do to make a difference from tomorrow? What one thing can each of you do in the different roles that you play to make a difference? You might want to come back to that question at the end of the day as well as you reflect on the day as a whole. Now, I'm going to hand over to you for thoughts and reflections, but here's the daft laddie questions bit. As I've been listening to the discussions this morning, a number of questions have occurred to me. Some of them may be genuinely daft laddie, some of them may have some relevance. But here's my attempt to reflect on this morning in the way of asking questions. First question that occurs to me is this: why should things be different now? We heard about Andy Elder and his filing cabinet. We heard from Stephen Boyle about Christie and all the other opportunities, reports, reviews which have suggested that we need to change things. We learned about what happened during COVID and how radically things were addressed. And yet, we are where we are today. So what are the barriers? Question that was posed by Jane Clare Judson. What are the barriers to change? How do we achieve the changes that are needed? How do we do better, to pick up on Jackie Bailey's point? How do we change the way we think? That was one of the points that the gentleman from Denmark mentioned as being part of what they went through. How do we change the way that we think? How do we reframe our language? Investment and cost. Again, Angelina mentioned the two of these. Unsustainability, Jane Clare Judson mentioned that too. The words we use are critical. So how do we frame our language in a way which is conducive with the encouraging effective change? To pick up Paul Johnson's observation, how do we back the proposed policy reforms? Reforms which have already been put into the system, as it were. How do we build on what's already there? How do we empower and enable people to take these forward? How do we make the hard choices that Andy more than once has drawn our attention to? The hard choices particularly about what we stop doing. And what does that mean? How do we assess our priorities? How do we allocate what will always be finite funds within the health and social care world and across all the sectors which are budget heads for a government? How do we fund services going forward? And that takes me to Donald McCaskill and social care. How do we reform and fund social care in a way which is meaningful? What is social care? How well do we actually understand it, Donald would ask us to think about. How do we integrate health and care, social care policy, if that's the right question even to ask? How do we move into that non-partisan space where politicians and parties can genuinely work across political divides, where people work across sectors, where vested interests are put to the side? How do we help politicians and others to quote Sarah Davidson, to take off the hats that they wear? To quote Angelina, to get over themselves. Or to quote Andy Elder, to find new and different ways of doing things. Critical. We all know this is critical to the future of health and social care. We have to find new and different ways, and the politicians have to do it as well. How do we enable ourselves and others to take risks, to innovate, to overcome fear, the fear of failure, the fear of blame, the fear of being held responsible for something not quite working out? Endemic, we might think, in this small country of ours. How do we help people to feel safe so that they can take those risks? How do we work together? Collaboration, collective leadership, we hear so much about that. Stephen Ball has been saying this for quite a while in his reports. How do we really collaborate? It's not just a linguistic thing. It's about implementation. It's about practices, about skills, competencies, capabilities. How do we build trust and respect? Again, Donald McCaskill referred to both of these. How do we have the difficult conversations that we obviously need to have, or the serious conversations to reframe? How do we engage the public, the private sector, the third sector, patients, all the constituencies, all the stakeholders, in necessary and genuine conversations? How do we take the learning, of which we heard much from Denmark and Wales, but we've also heard about Australia and Ireland? We're not too expert and too knowledgeable not to learn from elsewhere. There is so much richness. How do How do we not just listen to it on a day like this, but incorporate that into what we do? How do we create a healthy Scotland? How do we create a healthy Scotland? What is our vision? And finally, the question which struck me most of all, I think, was a question posed by Angelina. Where is the outrage? It's a good question. Where is the outrage, given all that's going on and needs to be done? Enough from me. I have one final question for you, and I'm going to hand over to you. What for you needs to be said now, this afternoon, that has not yet been said? This is your opportunity, if you would take it, and please do. And let me just preface this passage of the conference with these words from the writer Adam Grant. I don't know is not an admission of ignorance. It's an expression of intellectual humility. I was wrong is not a confession of failure, it's a display of intellectual integrity. I don't understand is not a sign of stupidity, it's a catalyst for intellectual curiosity. So, ladies and gentlemen, I suggest to you that what we need this afternoon, and we need in Scotland in the health and social care discussions, is humility, integrity, and curiosity. So, over to you for such contributions, comments, questions, and discussion as you would like to have in the 15 minutes or 20 minutes or so that we've got for this session. What's not been said that needs to be said? Yes, sir, over here. Thank you. Got a microphone coming down. And it would be good if you say who you are and maybe where you're from, so we all know who you are.
And my name's Cam Donaldson. I'm a health economist from Glasgow Caledonian University. I think it was Andrew Elder that said everything for everybody all of the time, that we can't have that. I suppose I would contend that's always been so, and I think there were a lot of nodding heads when that was said. I think the issue, though, is that when that manifests itself in the nature of a crisis, which we're, I think, in the middle of right now with respect to the National Health Service, and of which there have been several since the early 1950s in terms of funding crisis in the National Health Service. When it manifests itself in that way, the response, the policy response, the response of politicians, let's say, just to be a bit more provocative, is always reform. And we've talked about reform a lot today. We've used the word a lot. There's very little in terms of being said in terms of what it actually means. And I'm sure different people would have lots of different interpretations of what we do mean by that. But it's almost sacrilegious to argue against reform. You know, it just sounds such a wonderful thing, at least in most respects. The problem with reform, I think, is that what happens then is that the policymakers then come up with a new set of entities in the system that still have to cut the cake. So the cake hasn't changed, priorities still have to be set, but with all of the reforms that have taken place from, say, internal markets, retrenchment from internal markets, integrated care in Scotland, there's never any guidance issued as to how those managing the system are to do it. What are the criteria that they should use to make a decision that we're going to move resources from here to here? And I think that's part of the implementation problem. Because if they make those decisions, it's likely that if they're wrong in political terms, despite having been backed up by good process, then they might get a rap over the knuckles, they might lose a job. Yeah. So we need to come up with stronger processes for managing scarcity of resources. Those processes actually exist based on sound economic and ethical principles. They've been used in hundreds of health organisations around the world, including pockets of success here in Scotland. But of course, as usual, there are pockets of good practice that then don't get systematised, which of course brings me all the way back around to implementation as a problem again. But I think that's why things like integration has failed in Scotland, and why a lot of reforms along the decades have had nowhere near the impact that they were rhetorically purported to have.
So what would you suggest could be done to change that? What one step would you propose now to move this forward?
Well, there's probably lots. I mean, you go right back into the education of, say, clinical leaders and healthcare managers. I mean, a bugbear of mine is that they need to be educated in things like research methods, so they know what an outcome is and how to judge whether outcome has improved. They need to be educated, self-serving, I know, in my discipline of health economics, cross-cutting disciplines, less management school gimmicks and more basic research and things like health economics that they can then translate into their day-to-day management processes. So that would be an educational initiative. Let's
just pause. That's really interesting, isn't it? The idea that there is more that can be learned about how things are done, how processes can be implemented, and that can be learned from within the educational establishments in this country, feeding perhaps into the civil service. Just a thought, perhaps.
Yeah, I agree. Yeah.
Okay, good. Thank you for that. Thoughtful. Next one. Yes, along here, I think, a hand going up.
Thank you. I'm Ross Jaffrey. I'm a GP based in the Highlands of Scotland. I think I'm a minority group in this room. But what I would like to ask, basically, and explore, prevention of disease and maintaining population health appears fundamental to the survival of our future NHS. Some service delivery changes in rural and deep end areas have widened health inequalities. I'm going to use vaccination as an example of this, which is now showing a fourfold increase in uptake gap between the least and most deprived groups. How do we ensure reform is equitable across Scotland?
Okay, and I know with Alistair Noble sitting next to you, you've had particular experiences of that in the Highlands. So that's a rhetorical question perhaps, but how would you propose that the kind of reform that you suggest is needed would be achieved?
So I think listening to local leaders of health implementation, I think I'll be biased and I would say that funding primary care effectively, particularly in hard to reach areas and difficult to recruit areas, is absolutely crucial to continuing that equitable service level. I think without that, we're going to have a very a significant gap between service provision in many different areas of Scotland. So I think the platform's there already, it needs supported. Okay. I think primary care is the solution.
Okay. Alistair next year has got his hand up, so Alistair, yeah?
Yeah, I mean, we've skirted around this all day, but we've got an enormous amount of waste going on in the health service today. We don't need more money, we need to spend the money we've got wisely. And the example I'll take is delayed discharges. Now, whether anybody likes it or not, these people are not, they should not be in hospital, they should certainly not be in a consultant bed. And yet for as long as Andy has mentioned, they've been there. Now, that means that, and I like this example, we're actually buying 100 Rolls Royces when we could buy 100 Fiat Puntos. And in a recent conversation with one of the senior politicians in Scotland, he said it's even worse than that. We're borrowing the money to pay for the Rolls Royces. Now, no other system I can think of would have delayed discharges as your default, safety set. And a lot of what Donald was saying around social care, we have to have integrated health and social care budgets. And I know this has been a recurrent theme all morning, but if you do away with general practice, you might as well stuff the NHS. It will not survive. And this idea you can bypass general practice and not use that skill and experience Ross is just saying people come and see him. There's maybe a quarter of the number of people come and see him as doing practices where they haven't got good GPs and they're using locums all the time. And once people have lost faith in the system, they'll lose total faith in the system. It doesn't matter how many people they see. So we've got the data, we've got the clinical data, we've got the financial data, and the question I keep coming back to is why are we not using it?
So why do you think, just briefly, because we bring others up, why do you think we're not using the data if it does exist?
I think we're just frightened to make decisions. I think we've got into a completely woe is me, this is terrible, we can't do it. And we moved away from what Scotland was good at, which was making hard decisions.
Well,
we used to run the world on that.
Interesting point, isn't it? Yes, about our capacity to make the bold, brave and hard decisions. Comments on that, or other comments indeed? Yes, Brian Whittle.
I had to stay quiet. Never going to happen.
Brian
Whittle's Shadow Health Minister.
Yes.
I think, frustrated Shadow Health Minister for the last 10 years. I think fundamentally the issue we have, certainly within political circles, is we haven't defined the issue we're trying to tackle.
Say that again?
We haven't defined the issue we're trying to tackle.
Yep.
So we're coming up with solutions to problems we haven't actually identified. And it's always more money, more money, more money, more money. When actually what we should be trying to do, in my view, the fundamental issue is one of time. It's time for our healthcare professionals to deliver the kind of care that they can. We haven't defined what we mean by health. We haven't defined what we mean by healthcare. So how on earth do we produce a policy that'll enable that? And there's only two ways for me. You either chase headcount, we increase headcount, or we reduce the need at the front end. And actually, it's both of them. But if you continually chase headcount, which governments have done forever, you will always chase headcount. In my view, we should be looking at how do we retain, how do we create an environment which is better for our healthcare professionals to work in, and how do we deliver a preventative agenda, a real preventative agenda, which I have to say in Parliament is starting to be discussed, thankfully. How do we deliver a real preventive agenda that sits outside of health, a lot of the solutions? How do we create that environment where, over a period of time, which politicians are not good at, is delivering policy over a period of time that will actually address both of those issues?
So you were not, I think here this morning, Brian, we discussed quite frequently a longer term view. And we often thought of politicians and the need for politicians to take that longer-term view. You've sat in the Scottish Parliament for a number of years. What prevents politicians from taking the longer-term view that so many people in this room would agree is absolutely what needs to happen?
Politics.
Yeah.
Quite frankly, it is. I think, Jackie's here. Neil Gray's coming in later on, and quite frankly, I think we are not that far apart in a lot of the things that she might disagree with me, but we're not that far apart in the way we generally think of health.
Yep.
But somehow or other, we seem incapable of sitting in a room and going,
Well,
create a framework that we all agree with and sit it to the side over the next 10, 15, 20 years. And that incremental change will take that length of time. But politics is not set up for that.
So let's hold that thought for the final session.
Thought I could leave early.
Chris will pick it up in that final session, I'm sure. Further thoughts? Yep, somebody up the stairs, right up, second top, thank you.
Thank you. Hi, I'm Catherine Crawford, sitting down, from Age Scotland. And I think often when I'm out and about in my role as a charity leader, I hear often from our constituents, people that we want to hear from, people we want to talk to. And you asked what did we not hear this morning? And that's okay. We didn't directly hear from lots and lots and lots of the people that use the health services in Scotland. Weren't direct, well, obviously we all are, but not directly involved in these conversations. The assumption was sort of made that these are issues that are affecting all of us every single day, and the solutions need to be found from all of us. That's fantastic. and we look forward to those things coming forward. However, I think for most people, people are finding their own way through the challenges and traps and issues that are facing all of us. So people are seeking private health care, people are paying for care support, people are selling their homes, their dogs, whatever they can to afford that kind of care. So how do we find the golden thread, the golden ticket that seeks to those long-term solutions and gives us all, as people who will hopefully be voting in the springtime, something to genuinely hope for? And I think that's where hopefully the people in this room today, the politicians, but also the influencers, the policy writers, decision makers behind the scenes, should really be using our energies to come together and pull of those threads together more clearly, to make that plan for the future more visible, and hopefully bring a sense of the vigour that was in the discussion in this room into the general public, so that we go into the next period, everybody can kind of see that future.
So can I just ask you, if I may, what one thing can you do to move this forward?
I've been thinking about that because my job, dichotomy, I've got somebody phoning my helpline in the morning saying, it's awful, I can't get the care that I need, it's really tough, my parents can't get that care. So my job is to champion their needs. However, I also see my role as sitting beside, well, literally sitting beside somebody like Jane Clare and working constructively with influencers and decision makers to find the solution. Yep. So it's finding that balance in my role and really thinking how constructively we can be part of that future, making sure we represent people is something that I know the board of our charity is really behind us doing.
Good. Well, good luck with that, and thank you for saying that. Yes. We've got three now, actually. So right, there's a little group here just on your right-hand side. Yeah, one, and then next one, and then next one. Great. Thank you. Conscious of time, so we'll just, as quickly as we can.
I don't have solutions. My name is Cindy. I'm a radiologist working in Lanarkshire. I'm just going to read something out to you from Marine Oceans, which I thought describes everything, and I think it could help us reframe things, because we keep talking about money, and I think that's the thing that you say, what are we not talking about? We're kind of skirting around money. And I think I'm just going to read this. The title of this piece is from Marine and Oceans, and says, "From wretched country to world reference, Singapore's incredible success story." The background being I'm originally from Singapore. So it says here that on August 9th of August 1965, Singapore gained its independence in a hostile and chaotic context. 59 years later, or 60 years later, this underdeveloped country, plagued by poverty, corruption, and insecurity, has become one of the richest and safest countries in the world. So back then, at 1965, Singapore had a per capita income of around 500, the equivalent of Ghana. Compared to today, it stands at about $130,000, and makes it equivalent to countries like France. And we have a standard of living about to be #1 in the world. And the point being about taxation, right? So Singapore's maximum taxation is 25%, and you only hit that when you earn $1 million. Everything below that, be single digit most of the time. So I think, you know, and people talk about insurance, blah, blah, money is key. A lot of our difficulties, even though we're skirting around today, is money. Mm-hmm. And how are we funding that care that we need? You know, healthcare is a human right. And before we start talking about cutting, and you're absolutely right about how we're spending it is absolutely key, because we have a lot of money. But the taxation needs to come into it. Yeah. How we are paying for it needs to be discussed.
And that's a huge conversation, which brings in not just taxation, but economics, our understanding of economics and so forth. Thank you for drawing that to our attention. Yes?
Yes, so I'm Alcevic. I'm completely nothing to do with the NHS or anything. I'm just an external observer, shall we say. So I've written the question down because it's quite complicated, so apologies. But for me, I guess the implications from today is, what does it mean for the social contract and improving the public relationship with the NHS and, by extension, the government and the state? It seems that the current trajectory is to provide less for more, with both the taxpayer and the user of the NHS services getting worse outcomes as time progresses. I guess the key question is, how do we get the MPs and the NHS leadership to be the white knight acting ahead of the crisis, which undoubtedly is occurring. And I guess being, seen at that point as the political saviour, which is obviously very good for politicians, versus the reality of trying to act before the crisis, which is obviously going to take very difficult decisions and obviously be politically unfavourable. But it seems to me that, there's a lot of discussion going on and has been going on for a long time, but the social contract is significantly breaking. I think everybody in this room and in politics and the population are responsible. And I think that, in all honesty, we're seeing that manifest itself in our fragmentation of politics. And that is not good for society, the state or the government, and we need to act now, basically. So we look for trust. I think the trust is basically a simple scenario where if we don't trust each other, the manifestation of the social contract as we understand it is going to change dramatically and not for the best. So
Thank you.
I would phrase it like that. But as I say, I'm not party to any of these discussions, but that's my...
Could you just pass the microphone down to Rami in front of you?
Thanks. I'm Rami from Chaz. And what's been going through my mind listening this morning is around leadership. And I suppose I'm asking myself, how can we as a country attract, retain and unleash the calibre of leaders we need within the health system to deliver the outcomes we want for patients? And I mean that in terms of politicians, I mean that in terms of civil servants and those charged with running boards, health and social care partnerships and hundreds of voluntary sector organisations. What is it that gets in the way? What's in the system that stops that leadership being effective, drives people out or doesn't pull people in, and what enables it? And I was struck this morning, getting the bus here, I saw a bank of posters on a disused building for a political party, and the slogan that was written up on them said, "Save the NHS from underfunding, privatisation and poor leadership." And it made me think, if poor leadership is the rallying cry of, it was a poster for the Scottish Socialist Party, if that is what is out there, what is it that we need to do to enable effective leadership if it is being seen in relatively fringe political circles that leadership is a problem in the health service? And I think it is. What are we going to do about it? I don't have any answers to any of that, but that's been the question that's been going through my mind
And
today.
if we had more time, I would throw it back to you, but I won't on this occasion. But a good point, perhaps, to our good note to end on is the importance and value of excellent leadership in all that we do. So I'm going to conclude this session. Thank you for your comments and participation, and hand over to Amy, who will introduce the next slot on A Voice from the Front Line.